You are listening to the Julie Parker Practice Success Podcast, where you discover management insights and strategies for your successful dental practice. There are also interviews with key people in the industry who have advice and services to help you and your team achieve great success. Welcome to this episode of the Julie Parker Practice Success Podcast, and I'm really excited about this next guest. I was recently at an Australian Dental Association Victoria branch workshop around addressing the small number of dental assistants in the industry and coming into the profession as well. And from that meeting, from that workshop, I met the wonderful Tony Teasdale, who put me in contact with my guest today. And we're going to be talking about an aspect of dental assisting, which I actually didn't really fully realise was disappearing in the profession. Welcome, Ellen Krajnc. How are you?
Good morning, Julie. I'm pleased to be here. Thank you for inviting me.
Oh, it's just fantastic that you are here. And the thing that we're talking about today, or the reason why Tony put me in contact with you, was because of your work in the industry, but also around four-handed dentistry as well. And this, at the workshop, it was raised, this topic, that if it was four-handed, it would be more interesting for dental assistants to stay in the profession. And I thought to myself, it's so interesting because I've been a dental nurse since I was 17. I'm now 54. And I thought, for a start, that four-handed dentistry was going on and on and on. I thought that was just the way we did dentistry in the surgery because it's the way that I'd always been trained in the surgery. So before we get onto that topic, Ellen, can you give us a bit of a snapshot about your work in the dental profession? You've been in it for a long time. What's your journey been?
Okay. Well, we've only got an hour, but
we could make it a two-parter.
That's it. Thank you. Well, I started off as a dental assistant at the age of 17, just like yourself. And through that, I had a couple of decades or more in that environment. And I always had great bosses. And four-handed dentistry was something that you did back in the 70s. And throughout, and that's where that journey sort of kept on going, and I was always in practices, and some of the practices were really welcoming and wanted to engage you even more, and during some of those I actually had to build training manuals and train staff with that, so that was always something that was familiar to me. Anyway, in the late 90s I entered the corporate world of dental implants, and I worked in an organisation firstly with the agency and then with the subsidiary, and I started off in sales. I then progressed to training manager. So sales was 7 years, 12 years as training manager, and then product manager after that, where I relinquished my training role and went into a different path. Then COVID came along and COVID saw the end of my career come about through redundancy. And that was a global thing. It wasn't just me alone. Obviously, we know lots of people. It's changed during that time. And then for about a 6-month period, it was sort of like we all sort of were very much homebodies and trying to be creative. And I decided I needed to work again, and I wanted to work again, found out that dentistry was an essential service. I found out about an agency. And I then started doing some agency work and found it, quite stimulating because you had to be on the ball all the time. And with that, one of my practices that I went to was a long-standing client of my corporate time, and I have been working there ever since in a casual capacity, but still maintaining some of the agency work to give me variety. And so with that, when I was the idea of this four-handed dentistry really became something that I discovered during the agency days, where I'd be working with younger dentists than I had the experience within overall. And I'd say, look, I'm four-handed trained. And they weren't used to that, but they welcomed it, and it really had a very positive outcome at the end of it for them, in that they felt they weren't used to that amount of assistance or that proactive type of role that you took as a nurse. And so it was very satisfying at the end of the day because they weren't used to working with me, being an agency. This stranger walks into your practice and being able to sort of make a difference to their day, but they're also their patient's day. And to be thanked at the end of it is really another reward on top of that. And the idea of the four-handed dentistry then further went into a colleague who I'd worked with in corporate in another state, had also left the company and become the continuing education coordinator for the ADA. And I was invited to speak back in 2023 on their clinic day, and I had an hour and a half session, and it was really a great outcome for that. And from there, this idea sort of is slowly sort of getting somewhere, but it's a slow burn.
It's a slow burn.
I just think it's really great to share the knowledge, and disappointed, and also was under the same impression as you that four-handed dentistry was still happening in our dental world.
Yeah,
unfortunately, it's not, and it's a shame. I don't know why. I think they've just got so much depth to other topics now that it tends to be rather forgotten.
Yeah, and one of the contributors at this workshop gave one hint as to why it's no longer around, and that is that during the university days, that they're not allocated, obviously, one dental assistant per dentist, but you've got one dental assistant per 5 students, and so they get very used to doing it just on their own. And so that could possibly be one contributing factor. Now, just in case we've got younger people that don't fully understand what four-handed dentistry is, can you explain the concept of four-handed dentistry?
Sure. Four-handed dentistry is where you've got your skilled operator, so it's a dentist, oral health therapist, hygienist, and they're working with a dental assistant in using their clinical skills in their clinical sort of work in a stress-free environment. So where 2 hands of the dental assistant are working with the 2 hands of the dental operator. So there's 4 hands involved, and that means retraction, suction, instrument transfer, and even just comforting the patient. I know that's not four-handed, but it's just a more active role in that. So you're working together in a more cohesive way.
Beautiful. And I remember, when I was being trained in dental assisting, it was never called four-handed dentistry. And when I kept seeing over the years this four-handed dentistry, I did used to think to myself, is that 2 assistants rather than just the one? Because it was just so much a part of what we did. And I remember one particular dentist that I was working with, and his name was Graham, magnificent person to work with. And his kind of way of describing things was that there is the patient mouth and it's illuminated by the overhead light, and his hands and eyes remain there. And the assistant is doing everything so his hands can remain as close to that space as possible, and his eyes don't divert away from the mouth. And I thought, that's an interesting way of doing it. That means that all the instrument retrieval, passing over, all the things, that's all, getting the triplex and putting in the dentist's hand, that's all happening outside that illuminated circle, if you like, by the assistant, and all the passing over is happening within that illuminated circle, usually kind of under the chin, that sort of thing. But one of the reasons why four-handed dentistry was raised in this workshop around addressing the problem of reduced numbers of dental assistants in our profession is because this is one of the things that makes it a very interesting job. Would you agree?
Absolutely, it does, because you've got a far more active role and you actually feel like you're contributing more to not only the clinician's work effectiveness, but you're also contributing to the patient's comfort, because it is exactly how you said it, and it's a really good analogy that Graham gave you, is that circle of his work zone. And there's things called the zones of activity, but it's even more important that light-filled area. If you think of how many clinicians now work with loops, that zone is even smaller. And they have to focus if they're looking up and looking at the tray or looking for their instruments, then there's the change in light intensity as well that creates another sort of fatigue to their eyes and to their concentration. And what that is that's where the DA comes into play, where she or he can actually, as long as they understand that clinicians work technique, and they can then bring forward those instruments, or as a triplex, as you said, or maybe they're even got their own triplex and have that capacity and autonomy to work in, and they're actually doing some of the washing and drying and or retracting with that. So the hands are always engaged, or pretty much always engaged with that in mind. And so it is really important to reduce that movement and that fatigue on the body, as I said. And so ergonomics also comes into it as well. It's how we hold our bodies, etc. So, your guy was really, ahead of his time. And I think that's where we all learned, for us older girls, that's how that works. You're just looking after your operator and your patient, and you're far more engaged and satisfied, totally satisfied with the job.
I certainly
and knowledge.
I certainly was as well. And in that same practice, one of my jobs was to also make sure that the basic notes and item number and tooth number and things like that. He was one of the first dental practices that had a computer software system for for dental. So it was a great practice to work at. But that was part of my role as well. And you were saying that it is far more interesting and engaging for the dental assistant, but it forces that mindfulness around things. As a consultant going into dental practices, quite often I hear the complaint that, the nurse has been working with me, or this, I'm going to say assistant, because have you come across Rochelle Fisher?
No, I haven't.
So she's formerly of the UK, has moved out here permanently to Australia, and she does training for dental teams for setting up surgical setups and basic infection control and things like that. She's working a lot with Dr. Ros Franklin, who's also got Amalgamate and does all of that sort of thing. Rochelle's business is called Dental Assisting and Beyond, and she and I have spoken about the differences between dental assisting here in Australia and over in the UK. And over in the UK, dental nurses need to be registered. And in order to be registered, they need to keep up their CBD, their continuing development, professional development training, and get points for all the courses they do. And because of that, there's a whole bunch of courses for them to do as well. And so the standard of dental assisting or dental nursing over there in the UK is quite high, because everyone's continuing to learn and develop their skills. And if we introduce something here in Australia where there was that clear difference between a dental assistant and a dental nurse, that may assist in so many different ways as well. Because at the moment, you advertise for a dental assistant, you might get someone that's just finished their Cert 3, but haven't had that much clinical time. But you could also be in that same job applicant, you might be getting applicants coming through that have done extensive surgical training, and they know how to set up for, in a hospital grade situation and all the things. And so there's such a broad range between those two that it might be worthwhile. So I'm trying to train myself into saying dental assistant. But with some of the complaints that I get is that this dental assistant has been working with me for months now, yet they still don't get that after the etch we do bond. Like, we repeat this over and over again, but it's not part of what they do anymore. They're not foreseeing this next step ahead, even though they've done it many, many times. And I see four-handed dentistry as being absolutely the answer to that. Because rather than sitting there passively just waiting for direction, for four-handed dentistry, you are in there with the clinician looking for the next step to take.
Absolutely. And yes, now that you said Rochelle is from the UK, I have seen some of her clips really engaging. And as you say, the higher level of training is really quite different. And I've had a similar analogy given to me by a vet recently, that the veterinary assistants in overseas are higher trained than what we have here. But anyway, we're on about teeth here, not animals. Yeah, so it is very much that. It's about that proactive, it's thinking ahead, it's preempting, it's understanding the procedure and making sure that flow is there, because that's part of the efficiency and effectiveness of four-handed dentistry. Is the DA, the dental assistant, has that knowledge and has that autonomy, or it's not necessarily an autonomy, as you say, that is a routine procedure, and they ought to be going that next step and thinking that next step, having that ready, having that etch bond ready, and then even having the light, and all within sort of reach that is not overstretching and overdoing it, so that, and that the roles are really defined. That's important too, that there's a discussion before all this can take place in a practice as to how you think, what you think four-handed dentistry might be about. If they don't, that's where you can sort of help them with and understand that. But having that discussion first, because you've got to have the principle of the practice and on board with this whole idea, because everybody has to be there. You can't just have one doing one thing and the other one, I don't care about it, sort of thing. And then the roles then develop from there. Like, what are you going to be able to do? Is that practical for you to have a triplex on your side, or do they want that? And it's then learning those new skills. They're not going to happen overnight. This all takes time to become fluid and effective and seamless. You've got to have seamless instrument transfers. That's another thing with that. It's not just passing the etch or the bond or holding the curing light. It's a matter of, there's a whole lot more that the assistant can do, because, again, it's the clinician focusing on the task at hand and getting it done. And if you've got a patient who may not be also as comfortable because they may have either a medical condition or they're anxious or something like that, you want that treatment to be going at a steady pace without being speedy dentistry.
Nice.
It's not about speedy dentistry. Four-handed is just effective, efficient work techniques.
Yeah, that's a nice distinction between efficiency and speediness. We're not rushing anything, but we're just being far more efficient in it. And just from the perspective of washing and drying a tooth while you're going ahead and doing some kind of procedure, maybe it's a crown preparation, you're constantly rinsing it off, so we've got a clear field of vision there. You think about, as a clinician, the amount of times you are moving your hand away, putting your drill down, picking up the triplex, coming over, washing, drying, putting that down again, picking up the handpiece again, coming back. How often would that be done in some procedures? And all of that takes up time. And and these are this is one of the little examples of what can be achieved with four-handed dentistry, that the nurse is also, it's really taking the assistant from a reactive position to a proactive position.
Definitely.
In that surgery, isn't it? And so they're looking in there saying, would I be able to see clearly there? Would I want that washed off a little bit or dried off a little bit to be able to operate in there? And really immersing themselves in that treatment. So some of the benefits are, you mentioned ergonomics before, and when we're talking about clinicians, how many times have you come across stories of clinicians having to cut their careers short because it's been their body that's failed them?
Well, exactly. And the prime example is that opportunity I had to speak for the ADA. My hour and a half was comprised of a 1 hour presentation and a 30-minute actually demonstration. And with that, prior to the event happening, I met up with a dentist who had to sell his practice here in Melbourne, and because of the body just not being able to stack up anymore. And he's now doing a master's or higher on ergonomics. And he had a topic that he spoke on with ergonomics. And he and I worked really beautifully together in the demonstration because he was used to that as well. And we even had a little practice in Melbourne, and then it was just easy on the day, and he actually also contributed to that, and he also sort of complemented certain things that we were doing and re-emphasised that importance, because, as you say, it's the repetitiveness of that stop, start, pick up the handpiece, put it down, with all that, and it's really quite elongated. Yes, it gives them a bit of a break, but where the nurse can actually do, and as you say, if I can see, as a nurse can see, they're going to be able to wash and dry that area potentially, and that's a skill that you've got to learn to do it properly, because you don't really want it to bounce back into your face if you hit it wrong. And the thing is, you learn so much more as an assistant. You see what that restoration's looking like, or that prep is looking like, and what the challenges are of that, what that clinician's doing. In most cases, you're not going to see every single bit, but if you can see, you can learn, you can understand the importance of what your role then becomes and how that assists that clinician getting through it, because there can be some difficulties with soft tissue and that. All of that, you do learn a lot more. And I think knowledge is so important, and knowledge is empowering. And that's why I feel that's important for me to share with others, because I got so much out of my career by being that nosy or being that interested.
And I think that's it. Amina and I, my business partner, I'm just going to quickly, Mike had a quick cough. Amina and I recently went through this process of we had a few coaching sessions, and this coach said to us, why do you love doing what you're doing? Why do you love going into dental practices and working with dental teams? And we gave all kind of the surface level answers, and she said, no, but why? Deeper why? Why? And we're like, we're thinking we're giving the right answers, but she said, no, that's not your soul speaking to me. Why do you do this? And so it was the first time we really took time to deeply reflect on why we did certain things. She even took us through a meditation because we weren't quite getting there. And it did come back to that. It's not that we're passionate about dentistry. It's just that when you fully immerse yourself, throw yourself completely into the project of whatever it is that you're doing within the profession, even if it's not in the profession, whatever you do, throwing yourself in, learning as much as you can, giving as much of yourself as you can, the result is fulfillment. And we gained such fulfillment from our roles that we've played in the dental profession. We really wanted to help others, team members, to feel that same level of fulfillment and by having that impact.
Yeah, absolutely true. It is a fulfilling thing, because that's something I promised myself when I was 17, when I took up dental assisting, that I was going to be the best I could be. And I've always had that, the hunger for learning. I still like to learn new things. You know, you just don't stop that. But the more you learn, the more interest you have. And in the practice that I work in now, I thought I knew a lot about perio, but there's so much I have learnt just in that one specialist field. And, you know, my expertise was implants, but you just don't stop learning. And the more you engage, you know, your clinician works with you, you learn together. And that was another good thing, because you discover how well you can be as a team. And at the end of the day, you are a dental team. And the chairside part is really a very vulnerable part for the patient. It's a very personal space for the patient. And if you can make that whole experience a lot better, it's rewarding. It really is. And I do believe that's how it works for me anyway, and it sounds like it was similar for you too. Is when you learn, you satisfy, and you go home feeling like you've done the best you can, or you've learnt new things, and you just sort of think, I want to try that again because that made that person happy, made my boss happy, made me happy, and it just is just a nice way to have in your day, in your working day.
It's like my husband's Australasia's passion provocateur. So he helps people identify what they're passionate about and work in a passionate way. And it's certainly been my experience, your experience, that when we can flip it the other way around, we can throw all of that energy and enthusiasm behind what we do, and that itself then builds that passion. And you wake up every morning like, you beauty, I get to do all this stuff again every day. This is fantastic. And with, when we were talking about at the workshop, it really came home to me that, this could be one of the core reasons why we are losing people in the industry. We keep hearing about dental assistants quitting and going off to other roles within the dental profession, but also going off and being baristas and doing other roles as well. And, I don't know why I've got baking in my mind, but if you were an apprentice baker and there was a limit to how much involvement you could have in the way of making bread. You're watching it happen over and over and over and over again. You're like, I can bake that bread. I can bake that bread. I can play a larger role in this. But if you're constantly stifled down, then you are going to go on to something else because it's no longer interesting. And so it's such an empowering step, and it could be one of the most important things that we do as a profession. Bring back four-handed dentistry. Make sure that this thought of, there's no career progression for dental assistants. I say, bull, there is career progression for dental industry. Look what your roles have changed throughout you've stayed in the profession. Your role just continues to change. Certainly it's been the case for me as well. There's so many opportunities out there. But the role of dental assistant can be made so much more interesting for these assistants if we go down this path of four-handed dentistry. And some of the benefits, if there are dentists out there that are not used to it, have not worked in this way, they may think of all sorts of barriers to going down that path. One of them is the ergonomics. You are making sure that you are maintaining your body far more effectively, so you've got a far longer career, less pain, less stress on all of your joints and muscles and all the things and tendons and things like that. There is absolutely the efficiency as well. You are going to be getting through more treatment in less time, in not a rushed manner, but it's far more efficient because of the fact you are cutting off seconds on many, many aspects of that treatment every day. Patients, how often have you heard patients say, doctor and nurse, gee, they don't even have to really talk to each other. They just know exactly what to do for each other and it all works so beautifully. I've heard that sort of comment many times over the years.
Yeah, I do too. I hear it at least, a couple of times. The patient actually compliments my operator and I, says, you are an amazing team, or they'll tell reception how well their experience was today and how fantastic we are, and the reception comes back to us. So that's a real buzz for us because we love working together and we do make it fun. We engage the patient where it's appropriate. I'm also given that license because we're of a similar age, my operator and I, so we've got that longevity in dentistry. We love our work, we love doing it, and we like to keep that patient sort of involved. If we are having a chat, it is about something that, is there. But at the end of the day, we don't stop. The focus is on our patient. We don't stop and, do that. And I have found when I'm a patient, I don't like it when it's just disconnected in a way, but It's not about me. It is all those things that you said. It's about the time efficiency that comes of it. And at the end of the day, that could mean that your appointment schedules are running to time or maybe even a little ahead of time so you can finish your notes or maybe even go and have that coffee that you sometimes miss out on or just a break to stretch or do whatever. And the ergonomics is something that doesn't necessarily mean a huge change to how you have your setup and all that sort of thing. It's not like major costs. It's just about learning to work with what you have, maybe a little better or different positioning. So, no, but it is the biggest buzz is the compliment from your patients.
And there's that potential to have that fantastic relationship between the clinician and the assistant as well, to a deeper level than would normally be. You end up really being each other's right and left hand, and it's from that perspective too. It's a good human connection relationship.
Absolutely. And, you can take it really to all sorts of levels. I have seen it in certain things I've seen when I've been looking at different areas of four-handed dentistry where the assistant's actually handing the handpieces. They do that in America and all that sort of stuff. So there's a lot of that the assistant's even a higher activity level, but that's not practical always with the setups that we have with our tray systems. But, it is an incredibly bonding environment for that operator and that DA to have. And if you're constantly with that same operator, well, that just develops even more and more, and you're a really formidable team. But also, that should be also transferable between the clinicians and the nurses, the assistants who work in a practice, is that everyone's familiar, the DAs are familiar with the operator's work technique, and they adapt quickly to that, and it's a seamless transition. Doesn't matter which room you or who you're working with. That's the nice thing.
Well, again, with Graham, he would have the hand for a cram prep, for example. I think there were 4 burrs that he used during a cram prep. And I've seen some dentists use 15 burrs during a cram prep. But with the 4 burrs, I mean, he had step number 1, I do this, and step number 2, then I do this bit, and then step number 3, I do this. And so he wouldn't even change his own burrs. So he would just turn his handpiece over. I'd change the burr, he'd go back in again, and his eyes never left that tooth. So, yeah, it can work absolutely beautifully. The other benefit that I hadn't actually thought about when I was doing this as a role, but prior to today, our conversation today, I did a bit of research, that there is the potential for improved infection control too. And I thought to myself, there's value in that you've got the clinician's hands, which are kind of the most contaminated hands because they're in the patient's mouth, and they are being restricted to this smaller field rather than straying out of that field and including more of the room in their zone. Whereas the dental assistant, who's very trained in using retrieval tweezers and things like that, it may actually improve infection control as well.
Yeah, totally agree, because of that reduced contact with those surfaces or with those areas. And that's all about having those roles defined, where you actually have those discussions and planning when you're looking at four-handed dentistry, is saying and what you have, and also potentially having some of those items at hand in case you need them, so that that also then minimises it. Although then those things are on the bench, but if they're out of that zone, that potentially still okay. But it's also then just easier to access. You're not getting up and down off your stool potentially, or your chair, or you're not reaching across. So there's benefits in that too. That certainly, they're absolutely complementary to that aspect of the four-handed dentistry.
I can't remember who said it to me. It was only a few days ago. The memory's so bad. But I was talking about this topic because our conversation was coming up, and it's so front of mind for me at the moment. And this particular former dental assistant had said that she was starting to work with somebody. They'd never been exposed to four-handed dentistry before. They said, "Oh, it doesn't sound very good. It sounds complicated and things." And so she said, "Let me train you in it as a clinician. I'll train you in how to use me as a four-handed dentistry partner, and then see what it's like." And he was very resistant to it at the start. But she said, once we got over those initial barriers and that flow started, he said, "I'm never working in any other way ever again." The benefits are so obvious once you do it. So if there are clinicians out there, I would say absolutely give it a good hard shot and give it a really good try, because the benefits seem to be there for the clinician, they're there for the patient, they're there for the productivity of the practice, but they're also there, for this core reason why we think it's a great idea to bring it back into favour again, I should say. And that is, we're making the role more interesting for team members, and so we'll keep more people in the profession in those dental assistant roles. So the benefit seems to be so broad and obvious. Why not?
I know it is for you and I. That's just ingrained in us, and that's where there was a passion there for that. And you're right. It's just trying to ease that operator or the assistant as well into understanding how this sort of can be really great to do, and your patient will understand that too, because they're not going to be in the chair maybe for as long. As I said, it's not speedy dentistry, but maybe their anxiety reduces with that, because they're thinking, I don't feel like I'm straining and all that sort of thing, and it is empowering for the DA with respect to having more autonomy. And that's also not just, and I'm not saying DAs don't do this already, but it is also having a complete visual of that patient. You can see if there's any eye changes in their facial expression, their hands, or that where you start to think that they're getting a little uncomfortable, and I can alert my operator and just, or I will actually I have the ability, permission to say, is that uncomfortable? Because I can see some changes happening in them that they can't because they're wearing loops or they're focused on the task at hand. And that then you become someone who's really showing care for that patient, and that patient feels like they matter. It's not just a process that they have to go through or that we have to get through, that you actually have a human being at the end of it that is being looked after. And also the assistant can do a lot more. As I said, it just depends on practice to practice. But the DA is setting that patient up. They're putting the chair back, getting them to the right position, maybe noticing that the mouth is closing a little bit and that handpiece is going hell for leather. And that could be also a danger thing, or telling them to close up so you've got more cheek space, all that sort of thing. So they're the things that I see coming up because I can preempt it and I know what the procedure is going to be, or anticipate. Anticipation is really part of the role with all that sort of said. So, yeah, efficiency, effectiveness, empowerment and knowledge. You know, I've got it up there and I want to share it with others, and I would like to think that they find that helpful, because we might be in our careers a bit longer, and particularly if we're enjoying it, that's a good win-win.
Yeah, for sure. So if there are clinicians, because you're right, it does depend on practice to practice and clinician to clinician as well. And those conversations are so important between the assistant and the clinician to be able to give authority. What level, are you okay with me saying to the patient, is that a bit uncomfortable? Maybe open up a little bit wider, or whatever the thing is. That level of continual feedback is important. Otherwise, you don't want to be in a situation where you think as a nurse, oh, goodness me, I think I said the wrong thing then. The dentist seems to be getting a bit upset with me. So we need to be able to set those guidelines and authority around what everyone's comfortable with in that room. If people are intrigued about doing more around four-handed dentistry, what's a good approach to take?
First, have the conversation about what do they understand about it, maybe do some Googling what four-handed dentistry looks like, obviously, but then also to have the conversation about what do you think, or what would I like to be doing more as a dental assistant? Where do I see there's times when I could, I've seen something and I didn't think I could say anything or do anything, or what I might like to be doing that would be within the scope of what a DA is allowed to do. And then the clinician obviously has to be open to it in the first place. As I said, the principle of practice has to be open to new educating their staff to keep that staff and give them more job satisfaction and that sort of thing. So I think it's having that conversation. And then even when you start doing this, it's about constant reinforcement and reviewing and all that sort of thing, and see how you're going, and feedback that's respectful but honest and, robust if you want it to be. It is that autonomy that you're looking for about what that could look like. I have worked in a practice for a short space of time and I really wasn't allowed to speak to that patient, apart from bringing them in and all that. And I found that I lost that connection with the patient, but the clinician was the sole focus for that patient, and I was just there to assist, and that was it. So I found that I felt like I was muted a lot more, but that's how that practice worked, and that worked for them.
Yeah, that's it. And it is about, as a dental assistant, always be questioning, watching what the dentist or the clinician is doing, and thinking, what elements could I be doing instead? Like within the guidelines and, all the formal guidelines of permissions and what we're able to get done. All the things, like, for example, watching them drill the tooth, I can't do that, but I could help retract the tongue, which is what the dentist is currently doing right now. And so it's always having that question mark, what are they doing that I could be relieving them of that task? And it's, I think initially, and this is part of what Amina and I discussed with our team members, when we're talking about adding more energy behind the things you're doing, whether it's doing more tasks or having more interest, you think to yourself, it's also draining. I can get away with doing less. But it comes back to what we were talking about before. But if we do that extra stuff, we get more fulfillment. We're more passionate about our job. All of a sudden, we've got a deeper level of interest and enjoyment of what we're doing. And so the benefit is huge for the dental assistant.
I think it raises your profile, it raises your role importance, and DAs already do a lot. I'm not saying that they don't, and I don't believe it's adding, extreme load, like a higher load. It's just a depth of satisfying your own abilities and giving rise to your abilities that you probably didn't know you could do or would be allowed to do. And that's a really, really good thing to have to walk away with every day and to have that behind you or within you. It's really just a nice feeling.
Yeah, it really is. Do you know, with the Cert 3 at the moment, do they actually train dental assistants through their Cert 3 in four-handed dentistry? Do you know?
I don't believe so. It is a standard within the core of the, I think it's 5.4 or 5.3 something. It's about merely it states that you will assist in routine dental procedures. That's it. It doesn't go into any more depth or detail than that. And that is the only find the relevance. And there might be one other point below that in the standards that actually relates to some sort of assisting role or four-handed role. But it doesn't mention the word four-handed. You just can't find it. And so it's really sad that it has sort of evolved out of the scope of what we do, but it's still, we still have hands, we still have patients, we still have to do that. And just an example of something that you were saying is I used to hold the articulating paper. I would dry the tooth and put the articulating paper because your clinician's got the mirror and the handpiece ready to go if there's any adjustments there. And so that little thing can be really, that's just to help because we're not putting down, looking, the light beaming through their loops, all that sort of stuff. So there's lots of things you can do, and that, I could just keep on repeating myself.
We can go on and on, can't we? And I agree. And you become very dexterous.
You become very dexterous because you actually use the hands, the fingers, your instrument transfers, you're dealing with things like that, and you're using your wrist. You're not using the hands, or you're not just sort of like, oh, God, I wish this was over,
That's it.
It's you're in it till the end. You're in it, boots and all. And,
boots
that's
and all.
what I find satisfying.
Yeah. And I think that's it. It's, it's not just four-handed dentistry. You've got two very active brains, four eyes, like you've got so much, you've got everything with bells on in that space, making it, and so you can start to achieve all those benefits for each of the different aspects. The business, the clinician, the nurse, the patient, it's all going beautifully smoothly. And so it doesn't seem like there is any, not formal or certified, but is there any clinical training out there for four-handed dentistry? For example, if a dental practice wanted somebody to come in and say, teach us how to do this, is there anything available that you're aware of?
Not that I'm aware of, and that's where I've come into this bespoke kind of offering that I like to do, because I think that you actually see the environment that the team work in, you observe them, and then you give them the information about what we're looking at, what sort of areas would be what we're trying to address and what we want to do, and then we actually go into role playing, and we're doing that. So it's a really bespoke for that practice to do that. But it's a big ask of busy practices these days to down tools and do that. So eventually I've toyed with the idea of creating online training, but I don't believe it'll be as effective, and I'm still building the image portfolio for that. But I think it's where you have that hands-on training. It's the see, hear, do. It's there. You can correct it at the time. And yes, I would be in there for the day and maybe a revisit sometime down the track. But it's a matter of practicing it after. It won't happen straight away. All these skills take time to perfect. And, it's, that's how I would do that. But I don't believe there is anything out there that I'm aware of, apart from Rochelle, as you mentioned.
Yeah, and with if people were interested in getting you on site to get this kind of training done, I tell you what, I agree. There is a short-term cost. You're downing tools, you're losing money in the way of patient payments and wages, but that's a one-off. And then you get to spend the rest of the days being more efficient, more productive, keeping your dental assistants for longer. So the benefits over the long term far outweigh by huge amounts the drawback in the short term of getting this kind of training. What state are you in if people were interested in getting you on site to get this kind of training? What's their best next step?
I am in Melbourne.
Yay. Whereabouts in
Melbourne,
Melbourne,
on the dark side. I live on the dark side in the west. But, yes, I'm in Melbourne, and that's sort of that's the easiest sort of arena to work in at this stage. And so it would be just contacting me through probably my email to begin with, and sort of then we can have work out what your needs are or what they think their needs are, and then we can work out what works best if there is something that I could help the practice with. And as you say, it is the upfront cost and some time with the team, but then it's a constant thing with the team supporting each other because you've all learnt together, and there may be modifications that the team then help each other with when I'm away from that period. And so it's an ongoing learning and support that you go within your practice, and you've all heard that information at the same time to begin with. And it's kind of really quite interactive that way, because if it's without patience, you have that freedom of being, saying, no, don't do it that way, because it's very hard over a patient to do that. It is something that you need to do in your own environment without that patient there.
Yeah.
So,
and patients don't like feeling like they're guinea pigs.
No. And it's easier and the other thing is, if your one assistant is a patient and the other one is with the clinician and you're just doing mock work, then you can give feedback to each other too. And that's a huge learning tool from that. And then they swap sort of thing. And the last clinician I've worked with, he's a sole operator, so it's very difficult for him to train in front of patients, and it's a specialist practice. And so we did that when they have an afternoon where there's no patients anyway, and we did it that way, and it was really, just well accepted. It was a good way to do it. Yes, but it's a bit of an effort on the team side, obviously, to commit to that. It's a commitment.
It's a commitment, but the rewards are there.
I'd like to think so. I'm not doing this to just, waste people's time. I want it to have some sort of lasting legacy, or something that they can sort of incorporate into their practice, so it becomes a normal way of working.
Because people like you and I, we've, when we were assisting, in the early days, we stuck with it for years and years and years and years. There wasn't this high turnover. Yes, there's different generational changes, but if people are engaged, they'll hang around because they're interested in it. So I really see this as such a big part of bolstering the dental assistant kind of industry within the profession, and keeping people like us in that for years and years and years.
Yeah, well, you will hang around if you're enjoying it, and I think there's other factors there that might come into play, but we don't, whatever they might be. But there isn't that longevity that you and I worked in. I mean, I would sort of I think it was 8 years was my average for hanging around in a practice. So I wanted it to be good, and I was looked after in that time as well. And so there's a reciprocal benefit for both, or for all involved, if you have that sort of good working style and that communication between you. It goes a long way for everyone. including your patients. Patient satisfaction is huge then too. They know they're being looked after and they've got a great team looking after them. So they'll always complain about their fees probably, but hey, you know.
But as long as that's the only thing they're complaining about, we're doing good.
Well, that's right. Well, that's always been the case, hasn't it? So that's nothing new in that regard. And they're coming to you for the fact that they trust the clinician, they trust the work, and let's make it sort of true to what they believe.
Yeah, I love it. I love it. So your email address is going to be in the show notes. So if anyone is interested in reaching out, then they'll be able to do that straight away. Is it your email address, so I can actually mention in case people don't get to the show notes as well, is ellen@aljaconsultingservices.com.au.
That's correct.
Beautiful, beautiful. Well, Ellen, thank you so very much. I really appreciate our conversation so much. And I'll connect you and Rochelle because I think Rochelle's so passionate about this space as well. I think it's a natural connection there.
Thank you.
I really do appreciate it, and I really do encourage practitioners out there to reach out to Ellen and get this happening within your surgery and feel and see and experience the benefits, and you won't look back. Thanks, Ellen.
Thanks, Julie. I really appreciate the time and for the interest, and I look forward to hearing from my, interested parties.
All these new people coming on board and building up that industry again. Good on you. Thank you so much.
Thanks, Julie. Bye for now.
If you enjoyed this podcast, then I encourage you to head over to Amina and my website, dentalbusinessmastery.com.au. You will find all the information that you need if you would like to gain our assistance in helping you and your team achieve great success. If you would like to find out more, you can also email us directly at info@dentalbusinessmastery.com.au. Thanks so much for listening.